Thank you for joining me today. I'm Joe DiMatteo Jr., Doctor of Pharmacy, Certified Clinical Nutritionist. Today I want to talk to you about CoEnzyme Q10. We are just now launching, we've always carried CoQ10, but now we are launching an advanced version of it. Always wanting to stay up on the most recent literature, so I will go into some of the basics of CoQ10, kind of as a refresher, or if you don't know about it. And then at the end here, we will go into the new product and why it is something that we are launching. So coenzymes, I don't want to make it too biochemical here, but coenzymes, like their name implies, they help enzymes, okay? Enzymes speed up the chemical reactions in your body. Enzymes need coenzymes to activate. Very similar to vitamins. You can think about it, as a vitamin for all intents and purposes, okay? It's a natural substance. Your body produces it. So it's not an herb, not that there's anything wrong with that, but it's not an herb or some out there nutrient. It is a natural substance that your body synthesizes, okay? You can get it in food, but dietary intake is negligible. For example, estimate about 500 milligrams per day of CoQ10 are synthesized in the body. The average diet only contains 5 milligrams a day. So you're getting 1% of your total need of CoQ10 from your diet. So a lot of times, you'll hear people say, well, I don't need to take, I have a good diet, I don't need to take this or that. This would be an example. Your body, you may not need it because your body may be producing it fine, but in terms of getting this nutrient outside or within your diet, in terms of getting this nutrient within your diet, just doesn't happen in any meaningful way, okay? And what's important is demand for it increases in certain conditions. In a broad stroke, it increases in conditions of oxidative stress, cardiovascular disease, diabetes, etc. There are some more specific examples, but basically conditions of oxidative stress, and we'll get to why that is. And then further, production is reduced in certain situations. Oxidative stress being one of them, but also age. Quite simply, they notice and they can test levels that as we age, this tissue stores of CoQ10 go down, okay? Furthermore, some things are just simply genetic. There are 12 different genes that code for the synthesis and the entire process of producing CoQ10. A mutation in any one of those 12 is going to render you limited in your body's ability to produce, okay? There are two main functions, all right? These are the core two reasons why you need CoQ10, why your body makes it, why maybe you'd want to supplement with it. Number one, it's involved in ATP production. ATP is cellular energy, okay? This is not the energy you think of, stimulant, caffeine, even cortisol, hormones, neurotransmitters, none of that. This is energy at the cell level, so the cell can perform its individual function. Collections of cells, namely in organs, then perform their overall function in the body. So ATP is the critical piece of cellular energy. It is the energy, and CoQ10 is necessary to produce it, okay? So that's function number one. Function number two is CoQ10 is an antioxidant. More specifically, it is a lipid antioxidant. It is a fatty antioxidant, not like vitamin C or glutathione. It's more in the realm of vitamin E, okay? A lipid antioxidant, that is important because you need antioxidants in areas of high fat or lipid areas such as membranes. Vitamin C or glutathione is not going to help neutralize free radicals in a cell membrane. It needs to be a fatty antioxidant, okay? And CoQ10 is one of the major ones. So just again, to wrap up, those two functions are critical: cellular energy and antioxidant, okay? Lipid antioxidant capabilities. They're also finding that it's involved in anti-inflammatory in the sense of signaling, not so much in the pain-relieving sense. They're finding that within the cell, it does help the membrane's fluidity. So we are finding more and more out about CoQ10, but at its core, it's those two things, all right? So who should supplement with CoQ10? You can get a blood level. It gives you some information, but what's really critical is your CoQ10 level in tissues. That's extremely hard to measure. So kind of back to that question, well, who would want to supplement this and with this and why? I'll just go over, again, kind of the brushstrokes here. Kidney disease. CoQ10 increases ATP in the kidney, increases cellular energy. It allows the kidney to function more efficiently. Healthy kidney, not a big deal. You've got kidney disease. It's a major assistance to getting the kidney functioning more efficiently. Statin use. statins point blank decrease your CoQ10 level and decrease production of it. It inhibits your body's ability to produce CoQ10. Statins aren't the only one. That's the most famous one. That's the one that stands out because of the muscle pain. CoQ10 is shown to help with that. But bisphosphonates, like your Fosamax, alendronate, those medications that are used in osteoporosis, also beta blockers. These are very commonly used meds. Beta blockers like metoprolol, atenolol, okay, and also metformin. You're talking metformin, beta blockers, bisphosphonates. Those are some of the most commonly used medications. So all of these situations, you're typically elderly if you're on these meds. CoQ10 is already declining. Now you're taking a statin or a bisphosphonate or a beta blocker, and now you're inhibiting your body's ability to produce it. Okay, so that's where these things can kind of compound on each other. All right. Now, in a more specific condition, heart failure. Okay, we're talking about cellular energy at the level of the muscle. So, and heart failure, it's kind of just like it sounds. Your body is not contracting, it's not pumping very efficiently. Okay, the heart has a very high demand for ATP. The heart never stops, God willing. It keeps going. It cannot take breaks. It doesn't rest. Okay, so it needs to have CoQ10 in there to fuel the mitochondria and to fuel that ATP production. All right, so they've done many studies, okay, but just in a broad brush here, it's been shown directly to increase mitochondrial contractility, okay? Many studies have documented that, all right? And it also has been shown to improve ejection fraction, which is basically how much blood the left ventricle can pump out at one time. It's a critical marker of your heart failure status if you've been diagnosed with it. Okay, so it's even also been shown to help with symptoms of heart failure, such as fatigue and shortness of breath. Okay, and then also in that same vein, cardiomyopathy, very similar to heart failure, but instead of having an issue with your heart's ability to contract and to constrict and to pump that way, your heart is a little tight and it can't relax properly to receive the contracted blood. Okay, so many studies have shown effectiveness there as well. Okay. Blood pressure, it's been shown to lower blood pressure. Also, again, just back to that broad oxidative stress kind of condition situation, Parkinson's, diabetes, even Down syndrome. We have seen effectiveness and increased status in all of these diseases, okay? Its most common use, though, in terms of what people are using it for, is if you have been documented to have a mitochondrial disease or even a mutation in one of those 12 genes that we talked about. That is something that as we go further and further and genetic testing becomes more common, not only in traditional but also in alternative medicine, maybe we'll start to see that there's 1 or 2 mutations out of 12 and you don't have full-blown mitochondrial disease, but you do have some impaired production, all right? One thing, though, if you are supplementing with it, be careful with warfarin. CoQ10 has a similar chemical structure to vitamin K, which if you're taking warfarin, you know to stay away from, or at least to watch, all right? If you are going to supplement with it, take it with a fatty meal. Goes back to the lipid properties of it. You get best absorption using it like that, eating it with a fatty meal. So like I'd mentioned earlier, we are now introducing a new product. We've carried CoQ10 for years, a high quality product. We are not getting rid of that one that we have because it still is high quality, but we are adding to it CoQ10 Advanced Essentials. All right. I will kind of go through the reasons here of why we're going to do that. All right. Number one, the formulation. The one we currently have is in rice bran oil. It's perfectly fine, but studies have shown that the new one, the CoQ10 Advanced, it's now an MCT oil, has been shown to lead to the highest absorption. Number two, we're using ubiquinol instead of ubiquinone. I don't want to get too technical about that, but basically those two forms of CoQ10 go back and forth between each other pretty easily. Ubiquinone is the one we currently have. Ubiquinol is what Advanced will be. Studies have shown some controversy there, but no studies show really that ubiquinone is superior. Studies either show no difference or they show ubiquinol is superior. So we are very comfortable keeping our ubiquinone, but also know we're probably taking a step up here by doing the ubiquinol, and like I said, furthermore, putting it into an even better fatty substance to increase absorption. All right. Ubiquinol is the fully reduced form. That is the form that functions as the antioxidant. That is the form that it'll be in when it's in your blood, functioning as an antioxidant. Essentially, ubiquinol is in the bloodstream, is functioning as an antioxidant. Ubiquinone is in the mitochondria of the cell when it kicks over to its second main function, the ATP production. So, for example, a 2018 study out of China showed a 1.75-fold increase in blood levels of total CoQ10, measured ubiquinol and ubiquinone when taking 200 milligrams of ubiquinol versus 200 milligrams of ubiquinone. So, like I said, some show no difference, but others do show a difference, and it's really not the other way around. Really not seeing much, if anything, in terms of ubiquinone superiority. Okay, so the reason why we are adding this product, though, is even bigger than the forms. Okay, what's really unique about this is a precursor to CoQ10 called geranyl or GG. Okay, so some of the issues with CoQ10 supplementation. You can get it in your gut. You can take the right form like we have. It's dissolved in fat. You eat it with a fatty meal. You're maximizing absorption, ubiquinol. But so it's in your blood, and that's great. And it's functioning as an antioxidant at that point. We know that. But getting it into tissues is another level. We know that there is some entrance into, through the cell membranes. We do know that, but CoQ10 is a very big molecule. It's very, very inefficient at getting that blood level from, getting the CoQ10 out of your blood and into your tissues, where, again, it becomes involved in mitochondrial production. So that's where, again, going back to the precursor thing here, is that GG is a precursor to CoQ10, okay? So it is perfectly and easily uptaken into the cell, all right? So you have a blood level of CoQ10, not much is getting into the tissue, but now you've got a circulating level of GG, it's getting into the tissue, the mitochondria can absorb that and produce the CoQ10 right there. So we feel, even more than the formulation changes here, GG, the geranyl, is the critical component to this product and why we have added it to our line, okay? You can take the best CoQ10 in the world, but if you really need that ATP production component of it, it's going to be very, very limited. You've got to do higher and higher doses, and even then, there is a plateau effect, all right? The absorption in tissues is always kind of the missing link with CoQ10, and GG really, we believe, does help to solve that to a very large extent, okay? So again, to get the benefits from CoQ10, its two main functions: ATP production, antioxidant capability. We know you can get a high blood level from a quality product, but can you get it into the tissue? That's where CoQ10 Advanced comes in. That GG, that geranyl, really setting it apart to making sure it's getting into the tissue. If you want more details or more information, go check out AskJoeD.com. Thank you for listening. If you like what you heard here today and want to hear more of what we have to offer, make sure you subscribe to our YouTube channel and click the bell to make sure you get the latest notifications.